Hi, my name is Steve Threlkeld, and I'm an infectious disease specialist in Memphis. I'm recording a few short videos to deal with some of the concerns and issues that people have with getting the COVID-19 vaccine. The one I want to talk about right now is, I think, a particularly damaging rumor, and that is one that suggests that the COVID-19 vaccine could have an adverse effect on fertility issues, particularly with women, but even in men, so the rumors go. It really started because of a letter written by a couple of researchers in Europe to the European Medicines Agency with a concern. The concern went something like this, that there's a small, tiny, really, area on the spike protein, an amino acid sequence that corresponds very, very slightly with an area on a protein in humans called syncytin 1. And that protein, very simply, has purposes for structural integrity of the uterus, and therefore could have implications in being able to carry a baby to term. So the idea is that if you make an antibody against the spike protein in COVID-19, that antibody could mistakenly also attack the syncytin 1 protein area and therefore lead to problems with structural integrity of the uterus. Now, it's difficult to even know where to start to debunk this myth because there's so many problems with it. The first one and foremost is that those areas are not similar nearly enough for the immune system to make such a mistake. It takes a lot more similarity to get the immune system's attention. It is incredibly sophisticated. If it were that gullible, there would probably be no one left to hear the sound of my voice. We would have attacked ourselves into extinction long ago. That's for starters. Secondly, in the clinical trial, in a practical sense, there was no difference in the number of pregnancies between the placebo arm and the treatment arm. So there wasn't any difference in a well-controlled group of trials showing the safety and efficacy of this vaccine. We just didn't see it. And finally, and I think probably most significant, the argument makes no sense. It falls in on itself when you consider the fact that if you make just a few copies of a spike protein related to a vaccine, what do you think would happen when you make thousands of times more spike protein in an actual infection? We would be having a wave of infertility across the globe, the likes of which we have never seen before. And we simply do not see anything like that. We see a maintained level of pregnancies and fertility that we have always seen. So there's no truth at all to any of these sorts of concerns. But it's very hard to undo the damage here. Once people hear this, they think they're hearing it from reputable sources, and it can be very confusing. There are reasonable people who have reasonable concerns about vaccinations in general, but this is just not one of them. So please be sure to know that the sources that you're using are people and agencies that know something about the disease process, because we want actual knowledge of this virus to be circulated rather than rumors. And I think when you get the actual knowledge and see the facts, you'll agree that by far the safest maneuver is to get the vaccine for your pregnancy or for any other aspect.